Hello. You've been prescribed a DMARD, a disease-modifying anti-rheumatic drug, or a biologic medication. These medications are used to treat inflammatory conditions. They reduce pain and swelling and usually stop your condition from getting worse. Since these medications are quite strong, blood tests will allow your GP to assess your health, checking for any side effects before they become serious. These blood tests check the function of your liver to make sure it's clearing all the toxic substances in your blood. Then we make sure you have enough blood cells to carry oxygen around your body and fight infection. You must arrange to have these blood tests at your GP practice or other appropriate healthcare facility. You will need to have a blood test before you start taking the medication. This is to make sure your liver, kidneys and blood-producing cells are working properly. The frequency of blood tests will depend on the medication you are taking. When you first start your new medication, we may need to take blood tests every 2 weeks. This can be reduced to a monthly basis if there are no problems and the dose of your medication is stable. Once your results have been normal for a number of months, you will only need blood tests once every month. For some medications, you may only need blood tests once every 3 months. However, your blood tests may again be taken more frequently if there's a change in the amount of medication you have to take or if you start another DMARD medicine. If your blood tests aren't normal, we may recommend that you stop taking the medicine or that you reduce the dose. From our experience, the abnormal blood result will normalise once you stop taking the medicine or reduce the dose. However, we will monitor your blood more frequently until the tests are normal. Sometimes it's not your medication that has made your blood tests abnormal. It may be because you've been unwell or have had a course of antibiotics. If that is the case, the blood test should normalise. Your GP will consult your specialist and will know how often you need your blood tests. If you have any questions about taking these medications or want advice about having blood tests, please speak to your GP or rheumatology specialist.